So guys, today we will discuss about how a tooth goes into an extraction case or the indications of extractions. So basically extraction means removal of a tooth out of its socket without harming the adjacent tissues. So what are the indications of extractions? Usually a patient comes with a pain either having periapical infection or pulpal infection. So depending upon the case, the chronicity, we do extraction. Then a grossly decayed tooth, that is most of the crown portion of the tooth is lost and we have to do the extraction. We can't able to preserve it. Then root stumps, that is no crown left, only root is there. Then for orthodontic purposes, like first and second premolars are usually removed to make the space for orthodontic movements. So these are the mainly cases of extractions, or we can say any supernumerary tooth, any abscess, cyst, carcinoma, tumor surrounding the tooth is need to be extracted. So how we extract a tooth? Mandibular, maxillary and mandibular. In case of maxillary, too few similar points are there, like firstly LA is given to numb the area. Depending upon the number of tooth of the certain quadrant, we give the local anesthesia. Like in case of maxilla, we give PSA, posterior superior alveolar nerve block, middle superior alveolar nerve block, anterior superior alveolar nerve block, greater palatine and nasopalatine. While in case of mandibular, we give LA, that is inferior alveolar nerve block, mental nerve block, long buccal and lingual nerve block, depending upon the number of tooth. Then after numbing the tooth on the surrounding area, we use periosteal elevators to remove the periodontium surrounding the tissue and loosening the tooth in the socket. Then we use forceps to extract the tooth. Similarly in mandible, we use elevator and then forceps, or luxators like apexo and cryers to luxate the tooth. So we discuss now forceps used in extraction, that is maxillary and mandibular. In case of maxilla, we have 8 forceps, and in case of mandible, we have 5. So in case of maxilla, we have anterior forceps, premolar forceps. Anterior forceps has no space in between its beak, while premolar forceps has some space in the beak. Molar forceps of right side and molar forceps of left side have large space in between the beak, depending upon the size. Then fifth one is cow horn of right side, cow horn of left side, used for decayed tooth. Then bayonet for root stump, and then third molar forceps. It has long beak to approach the third molar. Then in case of mandible, we have anterior, premolar, molar of same side, cow horn and then third molar. In case of mandible, these are all present at 90 degree and these are at straight level. Then we have some luxators like pexo, criers, hockey stick to luxate the tooth, usually in case of premolars and molars. It is of right and left side, it is of mesial and distal side, and it is of mesial and distal side. It's look like this. It look like this, and it's like this. Then we have Copeland elevator, which is used for root stumps, which is like this. So these criers and luxators depends on three principles, that is wedge, wheel and axle, and lever principle. This states that there must be a sharp wedging area in between the tooth and the periodontium to extract the tooth. And this states that there is a circular motion, that is 180 degree movement to extract the tooth. Example in apex. And lever principle states that there is a effort, load and fulcrum to luxate the tooth. So these are the few points regarding the extraction, the indications, the steps used in the clinics, the forceps, the luxators and the elevators, and the principles. Thank you.